Well, we have for many years been interested in how blood platelets stop you from bleeding, and also thinking about how we can actually prevent the platelets from clumping together in order to be able to treat patients who are in the midst of having a heart attack so that their blood vessel will reopen and then stay open. So we work both ends, both in terms of understanding the what we would call hemostasis, the process by which you stop bleeding, but also thrombosis, the process that can lead to a heart attack or a stroke. So there are two fundamental processes that platelets do. One is they'll stick to a damaged blood vessel, as if you cut yourself. Now they'll stick. But then the second thing that they do is they start to clump together. So the platelets that first sit down, they bring new platelets in. So the first question that we had was, how does that happen? How do the platelets know to stick together? And so that was a lot of the basic research done in my lab over really 40 years now. Well, the particular question that led to a lot of our research was, how literally do the platelets come together? And what we ultimately found was that there's a molecule in between these two platelets that can simultaneously attach to each platelet. And they do that by interacting with things on the surface of one platelet over here, one platelet over here, and now a molecule in between. Research done by many laboratories worked on this problem, and one of the ways we thought we could perhaps get at this, and the question we asked was, could we make something that would prevent the molecule that ordinarily acts as the bridge from binding to the platelet? And that's what led us to produce something called a monoclonal antibody. And that monoclonal antibody would stick to the site on the platelet where the molecule usually binds to. But now, because the antibody was stuck there, this bridging molecule just couldn't do it. And so the platelets couldn't clump. And there turns out that there are patients who lack that receptor that this molecule binds to on a genetic basis, and we studied those patients, and those patients have a bleeding disorder because their platelets can't clump. But we thought, well, maybe if we have somebody who's in the middle of a heart attack, it would actually be good to block the ability of those platelets to clump for just that short period of time. And even though we knew that it might increase the risk of bleeding during the middle of a heart attack, maybe the benefit would greatly outweigh the risks of the bleeding. And that's what led us ultimately to develop the drug that's called abciximab. It's a funny name. That's its generic name.